Have you ever looked in the mirror and thought, I wish I could change this or that? If you have, you're not alone. In 2008, Americans spent a mind-boggling $10.3 billion getting nipped and tucked. But as you're about to see, plastic surgery doesn't always go the way it should. Just ask these two women.
I can't live like this. I'm like, this is like, I look like a freak.
People were always nice and said it didn't look terrible. It looked terrible.
These women have never met, but they share the pain of botched plastic surgeries. After a car accident, then 18-year-old BRENAE Brenner went under the knife to repair her nose. For the next 30 years, she was unhappy with her decision. JUDY KREPPEIN lost 140 pounds, and her quest for a better shape led her on a journey that ended with severely deformed breasts.
My right breast is almost 3.5 inches lower than my left breast. I said the left breast is up on the left-hand side. I said, and the side of it is shaped like a football and it's hanging underneath of my left arm.
Multiple surgical fixes left JUDY's body mutilated. Her original surgery in 2001 was revised because her implants were too small, and when they were replaced, they were too large. After those 3 surgeries, she had at least 4 more to repair the damage, including busted stitches and infections. The financial cost, over $30,000. And at one point, she lived without implants while her tissues healed.
For about 4.5 months, I went without a right breast. So I had to use gauze and padding, and I had to try to make everything contour, and it was really difficult.
JUDY searched for doctors with the ability to make her look human again, but no doctors would help her, something 48-year-old BRENAE Brenner identified with.
I did check out a few surgeons in the city, but the ones that didn't want ridiculous money didn't even want to touch it because they said it had been too damaged. So I kind of figured this was my lot in life.
After her initial surgery in 1979, BRENAE's nose was never the same and got worse over the years.
Imagine having to wake up every day and look at that in the mirror, and or if somebody's taking photos of you, cringing every time you looked at a photo of yourself. So I started taking myself out of photos.
Her nose haunted her, especially as she planned her wedding. The thought of immortalizing her imperfection in a wedding album made her sick, and she almost didn't get married. Eventually, she hired a makeup artist.
It was amazing. I didn't care what she was going to charge me. She had to be there, and she was there the entire time during all the photographs, every 2 seconds, touching it up with a specific makeup.
BRENAE had dodged one bullet, but history would repeat itself after she and her husband started a family, and their son was of bar mitzvah age.
I didn't want a makeup artist. I wanted it all better. I was tired of this. I had 2 other children coming behind him, and I knew this was going to be, and then they were going to get married, and you know, I just hoped maybe I could find somebody now.
And this time around, she found a surgeon who would help her.
How you feeling?
I'm doing good.
Dr. Sam RIZK took on BRENAE's case.
I took banked rib, which is rib that's been processed with, approved methods, and we used that cartilage to correct multiple areas of collapse in her nose to make her breathe better, and also to make her nose look straighter, more defined, and to correct the saddle ski-sloped nose that she had.
I had the bar mitzvah. I took pictures. I took hundreds of pictures of me. My husband made fun of me because I was the photographer. I told him to take a lot of pictures of me, and I said I was making up for lost time. Now I look in the mirror and I wonder, I'm like, what a beautiful nose. Because for me, it's perfect.
I think I might take this dress in case we go out.
JUDY KREPPEIN also wanted perfection, but came to terms with her disfigured body and thought this was as good as it was going to get. Then she met Dr. Tracy Pfeifer.
Hi, Dr. Pfeifer.
How are you today?
Good. It's nice to see you.
You too. Oh, Judy's case was by far the most severe case that I've ever seen. She had really significant asymmetries. Her tissues had been damaged from multiple surgeries, plus her tissue had been stretched out from having large implants in for a long period of time. She had scar tissue from her previous surgeries.
Dr. Pfeifer gave JUDY much smaller implants, but they provided a big boost to her self-esteem.
I felt like a human being again. I wasn't afraid to put on a bathing suit top. I wasn't afraid to wear a strapless dress. You know, my life had totally turned around 100%.
Happy endings, but not everyone is so lucky. Some botched plastic surgery is beyond repair, leaving patients disfigured for life. So it's important to do your homework before electing to have surgery. Here's my checklist. Pay attention. It sounds basic, but make sure your surgeon is board certified. If you're having facial surgery, your doctor should also belong to the otolaryngology board. Check with your state's medical board to see if the doctor has any medical malpractices and to confirm that he or she has a license to practice medicine. Make sure the doctor has privileges to perform that procedure in a hospital. If they don't, that is a safety issue. Also ask other doctors and patients for referrals. And make it a priority to talk to patients who underwent similar procedures to the one you're looking into. Coming up, more questions you should ask yourself to make sure you're ready mentally for that change.